Hello and welcome. Today we're diving deep into a specific urinary system disorder, type 1 renal tubular acidosis, also known as distal RTA. We'll explore what it is, what causes it, how it affects the body, and how it's managed. So, what causes this condition? Type 1 RTA arises from a defect in the distal tubule of the kidneys. This defect impairs the kidney's ability to properly acidify urine, meaning they struggle to excrete hydrogen ions. This can be due to a genetic predisposition, where the defect is inherited. It can also be acquired, resulting from autoimmune diseases like Sjogren's syndrome or lupus, certain medications, kidney transplant rejection, or exposure to toxins. Now let's understand the pathophysiology. Normally, the distal tubule cells are responsible for secreting hydrogen ions into the urine, allowing the kidneys to eliminate excess acid from the body. In type 1 RTA, these cells malfunction. They either can't secrete enough hydrogen ions, or the collecting duct cells leak hydrogen ions back into the blood. This leads to a buildup of acid in the blood, resulting in metabolic acidosis. This chronic acidosis has several downstream effects, like bone demineralization, kidney stone formation, and growth retardation in children. Type 1 RTA is considered a rare disorder. While precise prevalence data is limited, it's important to understand that it can affect individuals of all ages, from infants to adults. The inherited forms are typically diagnosed in childhood, while acquired forms can develop at any point in life depending on the underlying cause. The signs and symptoms of type 1 RTA can vary depending on the severity and duration of the condition. Common symptoms include failure to thrive in infants and children, slowed growth, muscle weakness, fatigue, bone pain or fractures, kidney stones, and nephrocalcinosis, which is calcium deposits in the kidneys. In severe cases, it can lead to cardiac arrhythmias or even coma. Diagnosis of type 1 RTA typically involves a combination of blood and urine tests. Blood tests will reveal metabolic acidosis, low bicarbonate levels, and low blood pH. Urine tests will show a persistently alkaline urine pH even in the presence of acidosis. Further testing may include assessing urine electrolytes, measuring fractional excretion of bicarbonate, and performing genetic testing to identify specific gene mutations in cases of suspected inherited forms. While we primarily discuss type 1 RTA, it's important to differentiate it from other types of renal tubular acidosis, such as type 2 proximal RTA and type 4's hyperkalemic RTA. Each type involves a different part of the nephron and has distinct underlying mechanisms. The primary goal of treatment is to correct the metabolic acidosis. This is achieved through oral alkali therapy, typically with sodium bicarbonate or sodium citrate. The dosage is adjusted to maintain a normal blood bicarbonate level. In addition to alkali therapy, vitamin D supplementation may be necessary to improve bone health. Monitoring for kidney stones and other complications is also essential. Unfortunately, type 1 RTA is typically not preventable, particularly the genetic forms. However, in cases of acquired RTA, avoiding exposure to nephrotoxic medications or effectively managing underlying autoimmune conditions can potentially reduce the risk. The prognosis for individuals with type 1 RTA depends on the age of diagnosis and the effectiveness of treatment. With appropriate alkali therapy, many patients can live normal, healthy lives. However, untreated or poorly managed RTA can lead to significant complications, including chronic kidney disease, growth retardation, and bone disease. Current research focuses on improving diagnostic methods, developing more targeted therapies, and identifying novel genes involved in the pathogenesis of this disorder.